I'm Kent Hungerford. I'm a specialist podiatric surgeon and a podiatrist. There I am on the left of our screen, but I'm also put a photo up of myself and Prof. Shi from my time in China. He's one of the leading foot and ankle orthopedic surgeons in China, and I'll tell you a bit about him and my opportunity to work there in a little bit. But yeah, I like to think I'm a local guy. I came in. I'm from Kiama myself. I grew up here and then sort of moved down to Albury-Wodonga and then Bendigo, where I completed my Bachelor of Health Sciences and Masters of Podiatric Practice. I think I moved around a fair bit over the last sort of 10 or so years, which has been very much to my benefit. So I went through to Bendigo, Tasmania in the northwest before going on to Geelong, and found my home in Canberra for probably the longest period that I was anywhere. Before then, being Canberra, and I worked with one of the podiatric surgeons there, which was a really good opportunity to learn a bit more of my basic podiatry and, venture into podiatric surgery. I then managed to gain a position within the Doctor of Clinical Podiatry run by the University of Western Australia, and that's recently been renamed as the Doctor of Podiatric Surgery to reflect what we're learning there more accurately. We work at a few different, various different departments and hospitals locally in that area, which really enabled us to get a bit of a better idea of sort of what's happening across a number of different areas as well. So we went through obviously radiology, pain management, vascular, orthopedics, plastics, endocrinology, and a few other different ones too. There were quite a fair few over a few different years there. But of course, we always came back through to orthopedics and vascular being, quite a large part of what we're looking at. Internal placements. So for those that aren't aware, the University of Western Australia has a pretty large podiatric surgical department and podiatry department. And we're able to have our own on-campus theatre there, which I believe is the only one in the Southern Hemisphere. And we generally undertook all our procedures under local anaesthetic, and the safety around that's quite a good option that we had. We used to operate twice weekly, and of the afternoons of those days, we would then undertake our post-operative consults and as well as see our new patients, and that worked quite well for us. But we also did a lot of external placements, and I worked privately with a colleague assisting him, primarily 2 or 3 doctors, where we did sort of weekly theatre sessions out of a private hospital. But of course, with everything, you can't stay local. And so I went through to America a couple of times, and the big one for me was China, where I spent 3 months at the People's No. 6 Hospital of Shanghai. And to say that was phenomenal is probably an understatement. I was able to scrub into quite a lot of procedures there and really get a greater exposure to a lot of broad idea of foot and ankle surgery. But a good one for us obviously is vascular, and I'm finding that's paying off a lot at the moment as I work with the local health district with high risk sort of podiatry within that domain, and that's sort of bringing back a lot of options that I sort of we're looking at within the vascular team out of one of the Perth public hospitals. As part of my work through with the University of Western Australia as a student, I was also able to jump on as a practice educator and lecturer. And so that's sort of like our internal supervision and lecturing. And my role sort of was working with the Doctor of Podiatric Medicine students who graduate as podiatrists, as well as the Doctor of Podiatric Surgical Registrars or trainees, who was sort of below me in the years to follow. From all of my training, I was able to gain a fellowship with the Australian Association of Podiatric Surgeons, and we've got quite a few members nationwide as well. Through all of this work, I became quite well known locally in Perth at the very least. Basically presented at a few different conferences on a few different areas. One of my areas of interest is low-level laser therapy, or triple LT, which you can see on the left there. That was me presenting at one of the conferences on that, following some of our vascular speakers and one of the professors from one of the hospitals. Also, obviously with drugs, I think this one was on the right was with the Australian Podiatry Association, just giving an update of the endorsed scheduled medicines and what that means for podiatrists and students as they're coming out. So, that's another good thing that, we should all sort of be striving towards as podiatrists. Bit of background, so you get a bit of an idea of where I came from podiatry-wise. Throughout my training, I did a lot with low-level laser therapy, and it's used for management of chronic pain and associated morbidity of the lower limb, and really helps to increase healing, decrease inflammation and pain. And I started a business there, Low-Level Laser Therapy Perth, and really focused just on the podiatry related aspects of, decreasing concerns. And I found that sort of worked really well in surgery, and something that I still work towards at the moment is providing that laser therapy post-surgery, just because it increases the healing, decreases the inflammation, decreases the pain, and really helps to get people back, where they were before surgery, and then moving on from that as well. Also did a lot of sort of advanced treatment techniques such as injection therapies, and I'll go through a little bit of that later. But also want to start offering these sort of options for you to do in your own clinics. Where we're able and we're confident, I want to put the theory into place and then start having people come through for quick training sessions on injection therapies. Because if you can start exhausting these sort of concerns before you come through or send a patient through for the potential opinion of surgery, I want to know that we've got those options exhausted as much as possible. And so if I can enable you to provide that within your own clinic, then I think that's going to be of a really good way for you to provide the patients all the options locally, rather than necessarily traveling through to myself, if that can be delivered within your clinic. But of course, standard podiatric interventions like our orthotics, bracing, taping, all that sort of thing is sort of where I came from as well. Surgically, I had a ball during my surgical training, to say the least. On the left there is through one of Perth's local private hospitals. And one of my mentors, Dr. Andrew Knox on the left here, and Dr. Burke Hugo, and this one's me just here. We had a great time there. Tom Douglas is our surgical nurse, and he's actually come through to New South Wales more recently, and will continue to assist me surgically here on the South Coast too. Professor Shi here, as I mentioned, one of the leading foot and ankle orthopods in China. He was a fantastic mentor, and we did a lot of full foot reconstruction and Charcot-Marie-Tooth, CMT. And I believe this was one of our patients after a CMT reconstruction there. As I mentioned, I did a bit of training over in America, and this was one of our cadaver labs that we did. And I just wanted to sort of show you this photo just so you can get a bit of an idea of the size of some of these labs and training options that are available internationally and locally. This one was specifically for minimal incision foot surgery, and was a bit of a refresher last September, October, I believe it was, in Chicago. And we were each basically given a cadaveric foot and a minimal incision machine, and sort of guided through that by some of the leaders internationally on minimal incision foot surgery. And so the guys that are named the procedures are the ones that were teaching us, and the ones that wrote the textbook were the ones that were teaching us. And so it was really quite a phenomenal experience to be a part of there.